Today we are talking about the Practice Health and Safety Assessment. Practice Health and Safety Assessment is the backbone of keeping you, your patients, and the community safe. This is all accomplished by providing you with sound, evidence-based practices that have been shown through research to keep our healthcare facilities aligned with various regulatory agencies that govern healthcare delivery. This assessment was developed from the team at Optum, consisting of physicians and registered nurses trained in the best practices for ambulatory care settings. After the go-live date, each clinic will participate in a 4-session Practice Health and Safety Assessment training, most likely spanned over 4 weeks. 1 training a week, approximately 1 hour in length, with continued follow-up and assessment of understanding throughout the remediation time period of 60 days to ensure sustainability. Throughout this process, your clinical integration registered nurse will be your resource.
Now we will talk a little bit more about your role.
How it will be an important part of the implementation of the Practice Health and Safety Assessment in your clinic and for your staff.
Once you are trained on all the components of the Practice Health and Safety Assessment, you will be responsible for ensuring that your staff is educated and is following all of the guidelines and regulations that make up Practice Health and Safety Assessment.
As mentioned, there are 4 trainings for the Practice Health and Safety Assessment. Today we are going to briefly review some of the components in training number 1, we discuss infection control and NPSG, National Patient Safety Goals. The infection control section covers a wide variety of topics, to include if staff knows where to find WellMed's infection control policies and how to use them. Does the clinic have appropriate commercial grade soap? Does the clinic have the right hand rub? Is the alcohol content 60% or greater? Is the staff practicing proper hand hygiene? Does the staff clean patient areas and equipment after use and use appropriate EPA-registered disinfectant to clean patient care areas and equipment? Does the staff utilize appropriate wet time when cleaning patient care areas and equipment? The NPSG, or National Patient Safety Goals section, includes questions like, does the staff use at least 2 patient identifiers when providing care, treatment, and services? Are informed consent discussions documented by the physician in the patient's medical record? Does the provider or staff conduct a pre-procedure verification process to ensure correct patient, procedure, and site involving the patient when possible, also known as universal protocol? And also, is the procedure site marked? In training number 2, we discuss emergency, scope of practice, equipment, and administrative. Is the patient medical emergency drill conducted at least annually? Is the AED checked daily for battery charge and monthly for battery expiration date and pad expiration? Does staff have a complete order prior to performing any test or procedure that requires an order? Does the practice report cases of possible abuse and neglect to external agencies in accordance with law and regulation? Does all equipment undergo periodic inspection, testing, and preventative maintenance? Is oxygen appropriately stored, signage displayed, and are logs complete? Does the practice have a written online policy and procedure manual, and do staff have access to it?
In training number 3, we discuss laboratory services, point-of-care testing, logs, and temperature. Are specimen containers labeled with 2 patient identifiers in the presence of the patient? Is the practice's CLIA certificate current and accurate? Are all lab sharps, needles, lancets, etc., and syringes secured during practice hours and locked to prevent unauthorized access outside of practice hours? Does the clinic perform any point-of-care testing? Glucose, H&H, influenza, lead, mono, PTINR, rapid strep, or urinalysis? Does the staff perform quality control testing as recommended by the manufacturer for the point-of-care testing equipment used? Does the staff keep a log of quality control testing that is done? Is there an accession log maintained for all testing performed, which includes the patient name, date of birth, the ordering provider, test performed, and date of test. Are only lab quality control reagents and specimens stored in this refrigerator? Is the lab refrigerator temperature monitored? Is there an alarm for temperature settings? In training number 4, we discussed medication management, medication administration, medication disposal, sample medications, and controlled substances. Are all medications secured during practice hours and locked after clinic hours? Does the practice follow a process for identifying expired and/or damaged medications at least monthly? Does the clinic label hazardous, high alert, and look-alike, sound-alike medications? Do staff label all opened multi-dose vials with the date opened, the 28-day discard date, and initials? Do staff clean the rubber septum of a medication vial prior to needle insertion? Does staff utilize a new needle and a new syringe each time they access a medication vial? Does staff change the needle after withdrawing medication from the vial and prior to administering medication to the patient? Is the medication refrigerator temperature monitored? Is there an alarm for temperature settings? Are only medications and vaccines stored in the medication refrigerator? Do staff compare the order to the correct patient, medication, dosage, route, time, and documentation, the 6 rights, prior to medication administration? Do staff ensure that all medication orders are complete, which includes the correct patient, medication, dosage, and route? Do staff report medication errors to a provider? Does the practice prohibit patients or caregivers from bringing in medication for disposal? Is there an inventory/distribution log of all sample medications, including patient name, quantity, lot numbers, and expiration dates? Are all sample medications labeled prior to distribution with the following information: patient name and date of birth, quantity given, and directions for use, and provider's name? Do only providers distribute samples? Are controlled substance prescriptions printed on security paper or with security features? Are all security paper and prescription pads stored in locked and secured locations?
We will continue to educate and train you and your staff on the remainder of the training sections. Together with you and your leaders, the Clinical Integrations team will support the assessment process and ensure safety at every practice that we assess.